everybody. I'm going to go ahead and try to get us started on time. We don't have a lot of time today, so and we have a bit to get through. If folks are comfortable turning on their cameras, we would love to see your beautiful faces. I just wanted to welcome everyone. I want to say in advance that we are likely not going to have enough time to cover everything that you might want to know about getting a diagnosis of dementia or being able to share today. I think that it might be helpful to you to know that we are actually, or I am, but also Connie and Jessica, the other co-hosts of this session, we're all represented or somehow involved in Prognosis, which is a public benefit company that I built that is a web and mobile app, among other things, with community health workers and caregivers connecting to other caregivers via the platform. We have weekly video check-ins, and the reason I mention this is because this session will probably not be enough for many of you. These sessions for Houston Harris County residents happen every Wednesday from 2 to 3 p.m. We will actually be doing a session for the first time on Sunday afternoon this week. Make sure to sign up for the app in order to participate in that. At the moment, it's kind of experimental to see how many people will be joining us from across the country, potentially across the globe, but go ahead and sign up for that session. I will say also that I wanted to acknowledge each of you who are here today for the work that you are willing to undertake. That's why you're here, I think, to learn more about what this is going to look like. And I also wanted to say that each of you is so crucial for our families and for our communities. We cannot do this work alone. And I think that it is it's much more possible to do it when we're doing it together. So here we are. You might be here because you're in search of the answers to questions about what explains the symptoms that you're seeing in your loved one, right? Changes in memory, changes in language, behavior. You might be here because you want to know whether you even want to pursue a diagnosis in your loved one, what that might mean for their life and yours. And some of you might be here because you are trying to figure out how to get a diagnosis, how you might feel about that diagnosis, and how you will deal with that diagnosis. I want to normalize, first of all of the feelings that people bring to the space, whether that is confusion, sadness, loneliness, resentment, all of that is very normal. And then I want to dedicate this session as much as possible. Apologies, I'm at the airport. Hang on one second. I try to speak over this. Am I interpretable? Are you able to hear me, or it's too much? Okay. I'm going to go and move us forward then. So I want to dedicate most of this time to interviewing Connie and Jessica. They are two caregivers who have generously given us their time this afternoon to talk about their personal experiences as primary caregivers who are both only children, who took up the task of providing amazing care to each of their mothers for over a decade. Connie, more specifically, cared for her mother with mixed dementia, Alzheimer's and vascular dementia in Los Angeles, California, with the help of her husband at the time. She organized tirelessly over many years to change systems for dementia care through faith-based communities, academic, government, and other public and private partnerships. Jessica is equally amazing. She simultaneously started caring for her mother while she was working. She had just, kind of entered the workforce, actually through the early years, and even towards the more recent years. Jessica's career continued to advance, and she became an executive ultimately with Teach for America, which is a educational nonprofit organization. She resigned from that role ultimately, to come back home and to care for her mom, to be fully present for the time that she has left. So I'm going to start off, before I say anything more, I want to say, is there anything specifically that Jessica or Connie wants to comment before I ask the question?
No, I don't have anything.
I'm all set. Thank you. I do want to also acknowledge, though, I guess I do have something to say. The two of us we have cared for our parents, and acknowledging that there are some of you who might be here caring for a spouse, a sibling, but just acknowledging that, like, as we talk through the dementia, hopefully that you all can take something from our experiences, but also give a plug for the stories that you can learn from on the Prognosis app from people who actually are spouses and caregivers. And so I just want to acknowledge that if you came expecting to hear that, you won't hear that from me today.
I will say again, like, if you sign up for the app, we have a library of like 350 stories in English. We also have stories in Spanish and in Korean. One of the caregivers who contributed stories to the platform, she has about 50 stories there. She is a spousal caregiver, currently caring for her husband, and her stories are fabulous. They are different in some ways and then overlapping in other ways with the experience of being a child caregiver. But it's important to, I think, recognize those differences, and I think helpful to connect to the specifics of those stories as well. So I encourage you to all check them out. They're very short stories. They're like 2 to 4 minutes, something like that, each of them. And it's about the whole breadth of the journey with this disease. Okay, so the first question that I have this afternoon is, how do we deal with loved ones who don't have a diagnosis and perhaps they don't want one? Or how did you each deal with that?
Well, my mother knew something was going on because she asked me several things. She said, I'd like to turn my house over to you. So we went to do that. And she had several accidents. And she asked me, would I take her where she wants to go? My ex-husband told me I was going to have to tell her, but she knew it herself that she didn't want to drive anymore. She couldn't drive anymore without having accidents. So just things started happening. She asked me to help her with her bills, all the things that you read. That's what she did. She knew more about it than I knew about it, but she could feel that she didn't have the same cognitive ability as she had. And I took her for a diagnosis, and they sent me to a neurologist, and the neurologist said that she had normal aging memory. But when I brought her home, and she kept doing the same thing. 2:30 a.m. she comes in my room. Where's my money? 2:30 a.m. I mean, this went on for a long time until I said something is not right. And someone else, my Alzheimer's support group, suggested that I go to a neurologist in that building, and she had vascular dementia, Alzheimer's disease. And that was over in a year. By that time, I had 2 nervous breakdowns and was hospitalized twice. So if I had the information earlier, I think that would have been, it would have given me the know-how, the what is, and then I can figure out how to do it. But just not knowing, not having it, and having that late diagnosis was not good for me.
Yeah, just to add on to that, my mom, she didn't want to get a diagnosis, but I do think something I'll bring up for all of us on this call is, like, how do you navigate knowing that there might be something wrong, and that getting a diagnosis would be good, but your loved one might be hesitant or would not react well to you making doctor's appointments. And so the way that I navigated it 10 years ago was truly like putting the pieces together for my mom to help illuminate the story for her, right? Illuminate what I noticed was happening and acknowledge for her that like that wasn't part of her normal routine, and that we wanted to make sure that everything was okay. And so I wouldn't say tricking her or convincing her, but rather just helping her see that this was something bigger than her. I would also acknowledge that like helping someone desire to get a diagnosis, it's sharing the benefits of what a diagnosis could mean for the realities of their life and like their well-being moving forward, right? Like, as I know that getting an Alzheimer's disease diagnosis, you don't leave with very many resources. However, being clear about what might be happening actually allowed me to ask more targeted questions, actually allowed me to seek out other resources to be able to get the support that we needed. It allowed me to actually understand, like, what is it that I now needed as the caregiver to be able to support my mom best. And so getting a diagnosis is more than just being like, I was right, something's wrong with my mom. It was now like, okay, now that I know, I'm now empowered and clear about the questions I need to go ask other people for, at least sit on my computer and Google at the time, right? There's now better resources than Google, but that's what I would offer to that question.
That's great. That actually kind of touched upon the second question I wanted to ask. I would only add additionally that for those who, are with it enough and we want to be respectful of their autonomy, what we can make sure that we do is to ensure the environment is safe for them, that we are doing everything we can to minimize the amount of harm that can happen to them themselves and to people around them. Early in the disease, it's not as worrisome as for when the disease progresses, and that becomes more of a concern. But yeah, there are many people who choose not to get a diagnosis. I think there are, as Jessica mentioned, many reasons for why it is important for the caregiver, for the care recipient, but still people choose not to do it sometimes. So then it's like, well, think safety first, for sure. Okay, I think maybe one of the things that we didn't actually discuss too much is what are kind of the breadth of the barriers that you faced in getting that diagnosis, the external barriers.
Donna, repeat that, please.
What were some of like the challenges that you faced, not from your mom or from yourself, but from the external, like from other people?
Okay. Well, for me, I didn't get the correct. Well, I know now that my mother's primary care physician had the ability to diagnose her, but he didn't want to. So he sent us to the neurologist, and he gave us something that wasn't true. So I think we have to start calling these doctors on things. I need to go into my doctor and tell him that this, and this is happening. And I want you to do it and them to do it, and then bring everybody together so you can have a second opinion. Because I just going a whole year without knowing, it was devastating to me. So that's one of the barriers, that they pass the buck, from one person to another person and then another person. But where I took her was a geriatric clinic, and they brought doctors in from every place. So you did everything there, your mammogram, your pap smear, they tell you whether you have Alzheimer's, and they know how to deal with people. So I think it's just because the doctor, we had him for a long time, and I think he didn't want to hurt my feelings. My feelings were already hurt because I knew something was going on. So I would say the doctors are a barrier in passing the buck and not listening. And yeah, they just don't listen sometimes and validate what you're saying.
Constance, I think your experience is resonating with people who are also sharing things in the chat as well. I would say I didn't experience any barriers to get a diagnosis, because I being at the time, I was 26 years old. I was also a long distance caregiver. And so I was only home in Virginia for, weeks at a time. And so I was really dogged on making sure I got what I wanted and needed in the times that I was, home to get my mother to doctor's appointments. With that being said, I didn't even have this conversation with my mother's primary care physician. I knew that I needed a neurologist. And so I myself was already frustrated with her PCP, and I knew that I wanted someone who was going to be an expert, that I perceived to be an expert. And so I asked for referrals to local neurologist offices, and I found the one that had the first opening while I was in town and went to him. And it was my relationship with that neurologist that actually kicked everything off. And so I would say I didn't experience any initial barriers there. And in fact, I would say quite fortunate in terms of how quickly things moved in terms of getting my mother seen, getting her reviewed, getting all the tests done. And sure, it does take time, but I never felt like anyone was keeping me from that. What I will say, the barriers came after a diagnosis. The barriers around navigating Alzheimer's disease come now when taking my mother to hospitals or doctor's appointments and not being listened to or believed because my mother can't articulate the thing that might be wrong with her. The barriers come like when people don't take the time to look further into other issues that might be happening within her body beyond Alzheimer's disease. And so I named that in that I didn't have trouble getting the diagnosis. The problem now is navigating the system now that we have a diagnosis.
Thank you very much. That was really helpful. I think the one other thing I will just name is that, and this is something that we really take into consideration with prognosis, that communities who are disproportionately impacted are African American, Latina, uh, Indigenous communities in the United and abroad. And I think it's important for us to think about, in general, the systemic challenges that we face, and to just, we just have to work harder, I guess, until we can transform those systems, which is also important to do if we have the bandwidth to do that at some point. But as we're going through it, we just have to know that we're going to get pushback because they're just biases that people have, and the medical system, the people in it don't reflect the population in the United States, and so it can be really, really challenging. The next question that I have is, what makes the diagnosis of dementia? This is one that I will mostly answer, but I welcome other input as well. How and what information should you have on hand to help help your doctor come to a diagnosis? And I know that there was one question in the chat about this, a doctor who was kind of hesitant to commit to a diagnosis of dementia. And this I've seen a lot anecdotally from primary care providers. So this would be like your general practitioner who might be trained in internal medicine or family practice. They are not expert in the brain, right? And so I understand, and also they're often, like many medical professionals are, super, super busy. So it's hard to get them to commit to that kind of has very serious implications. So what often happens is that they will make a referral to ultimately neurology. As Jessica mentioned, she knew to go to neurology, right? Sometimes we can or cannot do that depending on the kind of insurance that we have. And if we don't have insurance, that's another challenge altogether, right? It's that specialists are very expensive as well. But neurologists and geriatric psychiatrists are usually the ones who will make a solid diagnosis of dementia. And it is, at the end of the day, what we call a clinical diagnosis. So it's largely determined by clinical history. And the kinds of questions that we ask on our app are actually reflective of the kinds of questions we ask in clinic to ascertain, is this something that looks like it could be a reversible condition that's causing, like maybe our loved one has a pneumonia, infection, COVID, that is causing them to not, be at the top of their game. If this is something that's been going on for a year or longer and it's getting worse over time, it's likely to be something like an acute infection. So, having that information is really, really important. And a doctor, a primary care provider should actually help to rule out those things, those reversible might explain happening with your loved one. The diagnosis of dementia specialist. They may also order like an MRI of the brain, which is an imaging scan of the brain. They order an EEG study. These electrodes, they plaster on it, the electrical activity in your brain. And that's if they are worried that their measures are causing the cognitive decline or the problems with memory. They might think of disease in particular, the most common kind of dementia, impacting about 60 to 80% of all people who have dementia. So they might
She's in an airport. Oh no, the neurologist and the neuroscientist is gone. However, you still got me and Connie. So unsure of where she was going to go with that. But I think she was naming the tests that the doctor would order to help rule things out. What I'll also offer from the family caregiver perspective, and Connie, feel free to add here. I basically took a notebook of all the things that I was noticing happening to my mom, right? Like doctors basically put together trends and they put together like a story based on what you tell them. So don't just go being like, oh my gosh, I'm worried about their memory. Go naming like any physical things you noticed, any like cognitive changes you noticed, things that are typically off how they typically show up. That was helpful to be able to tell the full story, because dementia is an umbrella. There's a number of things that actually could be the cause of your loved one experiencing dementia. And so the more information you bring to help tell and paint a better picture, the more accurate or close to accurate your physician can be as they're putting together the pieces of what might be happening to your loved one. That's what I would also offer in getting a dementia diagnosis. Connie, would you add anything?
Well, I just think we should have set aside doctors like the geriatric center where you can take your loved one, because I was so upset during the 10 years that I cared for my mom. I took her every year. We went for our pap smear or our mammogram, and they told me not to bring her back again because it was hard to get her to do what she needed to do in order to take the mammogram. And I said, well, what is the age limit on cancer? They said there is none. I said, so I'll be bringing her back. If he'll have to get somebody else to see her or refer me to somebody else, but I'm not going to allow another chronic disease in my mother's body because you are not able to handle her. So that was one, and that happened also with the gynecologist. They just want you a certain age. They feel like you've lived long enough and you've had a pretty good life, and they'll just let you go. But I wasn't going to let my mother go that easy, and I didn't. And I think that we all should stand up. I know you do, Jessica and Donna, but you just have to let them know that, look, I'm paying your salary. If I don't come here and sign this Blue Shield, Blue Cross, or Aetna, or whoever it is, then you don't have a job. So I mean, there's so many doctors that you can go to. You don't have to stick with one. So that really did anger me. It really, a lot of times, it just kind of hurt my feelings, because it was like, well, she wasn't their mother, but she was my mother, and it was hurtful. But I just kept, bringing her back and telling them to get somebody, train somebody how to work with a person that has Alzheimer's and dementia. Make a new machine. I don't care what you do, just see her.
Absolutely. It's always really frustrating when it's like, that your loved one deserves to be seen and to be given the respect to be evaluated for anything, and you're fighting the uphill battle and you're bringing everything. You want for everyone to be doing that too. So I definitely feel you there. Let's see. Okay, it's 4:40 Eastern time. We have about 10 minutes left in this session. I know something that Donna wanted to do was to open it up for questions from you all to engage, to get some real-time thoughts answered. And so I see some things coming across the chat, but while we look at the chat, Connie, do you have any closing words or highlights that you want to make sure you share, make sure you say before we get to Q&A?
Well, I would just suggest to each and every one of you to take not even one day at a time, every 5 or 10 minutes at a time, because things change so rapidly. And I learned to change along with them, because I used to be rigid like my mom. Everything had to be this, and this. Alzheimer's came and said, no, it might be that, it might not be that. So you have to, and take care of yourselves. So you don't have to, they put me on this medication called Xanax. And I was on it less than 30 days and got hooked on it. And then they had to wean me off. So if we can just do what we can do, and if you can't do anymore, just find somebody that can come in and help you. Ask one of your siblings, one of your neighbors. Ask someone if you need help.
That's good, Connie. Hi, Donna,
Thank
you're
you,
back.
Jessica. Oh, they're here.
Thanks for moving us on to questions. I have questions, but we'd love to hear from some of the caregivers here if you have any you'd like to ask of us or anything you'd like to share. There's one in the chat that I think, maybe, I don't know if you have any advice there, Jessica, Connie. I mean, this is the question we were asking of ourselves earlier, which is, if your loved one is not wanting to have the diagnosis, then what do you do? And, sometimes you're not going to be able to get a diagnosis for various reasons, and this is among them, right? And this is where I said, again, like, it's important to make sure that they're safe. So there are many things you can do in terms of home safety, in terms of starting to build that care team, which was actually the question I didn't get to ask you all. So, I know, Jessica, you've shared many stories, and also Connie, you've shared many stories of how you leverage the people around you, right? Like the neighbors of your mother, other people in the community, to ensure that they were safe, and more than safe and secure, that they could continue to thrive as they advance with their disease. And you were fortunate both to ultimately get diagnoses, but some people, they are not, and it doesn't mean you can't move forward still with a lot of these things that we should do.
Are we able to ask a question?
Of course.
I have a loved one who refuses to think that there's anything wrong with her, and she refuses to go to the doctor for a diagnosis. Under any circumstances, we've tried a number of different things. Question I have for you is, should I be confrontative with her, or should I be just go along with how things are, because we've tried so long to change her mind? That's a key question right now. I don't know what to do.
I will say really quickly, depending on how advanced she is, the nature of this disease is that you lose insight as you advance. In the very beginning, people often do know, they realize they're having some problems. And there is just a lot of shame and stigma around that. And so they don't necessarily acknowledge that they're having those problems. As the disease progresses, they actually lose awareness of it. So I think in general, it's not helpful to insist like you have something wrong with you. I don't know if Jessica or Connie, you have any other thoughts on that.
I just thought about something, but if you would tell your wife that you think you're having some problems and ask her to go along with you to the doctor, but you have to let the doctor know that it's really hurted, that you want to see. And then I think they give you the 5 words or something, and then they say it back to you. You do that and let her do that at the same time. So the focus is not on her. You're not saying anything is wrong with her. You're saying, I think something is going on with me. Would you like to come along with me, or I'd like for you to come along with me to this visit, and then work it out from there. Put them in charge.
I think
Because
that's good.
huh?
I think that's good advice, but we tried that.
Oh, Oh, well, let me think of something else.
So,
I-
yeah, that's
And that
basically,
didn't work?
no, that did not work.
Mm.
But she's pretty smart.
Mm-hmm.
Hey
Wow.
Ed, it's Jessica. So I will just name that I'm speaking from the lens of just family caregiver. I recognize that you all have tried everything, and I'm not going to offer probably any solution that you haven't thought through. So I think at this point is where I would lean on what Donna shared around, like, maybe fighting the diagnosis battle is not what we need to be fighting right now. What are the things that are changing that I need to now adjust either in the home or around my loved ones, so that, you know, as I'm noticing things being different, they are still safe, well cared for, and can thrive in how things are changing. Now, granted, for instance, my mom was like, why are you labeling things? And I was like, it's so that you can actually be independent, whether I'm here or not, and be able to find things, which is one example. And so what I would say is, whether it's labeling something or, you know, safety measures in your home, I would take the step of like noticing the changes and thinking about what are the solutions to address the things that I'm noticing until we get to the point of them being okay going to the doctor and getting a diagnosis. Only because I think what I often see in families is they spend so much time trying to figure out how to get a diagnosis and convincing their person to go to the doctor, that they miss like the precious moments and the chance to still just treat and see your person as a human. And so I just want to acknowledge that even while waiting, while trying to figure out the best like way to get them there, there's still so many things that you could be doing behind the scenes to create as like smooth and as caring of a place to be for your person as possible.
Good, Jessica.
Again, I don't want to monopolize all of the time and questions. We're talking about my sister who's married to a man who's 15 years older than her, and he's in his 80s. He seems to be taking care of her pretty well, but he is frustrated and he's at his limit.
Mhm.
That's to a great extent what the issues are. I'm her brother, obviously, and I sit outside and she calls me in the middle of the night saying, there's a man in my bed. What should I do? Should I call the police? She doesn't recognize her husband. Sometimes she thinks he's a woman. She's 68, so seems to be kind of young to be at that point, but I don't want to continue on with that, but in the description, you all probably have similar stories. My problem is that she refuses to do anything, and I don't know what to do.
Hi, Ed.
Um,
This is Yvonne, and I'm dealing with my aunt who's in denial about her vascular dementia. And what I did, her short-term memory is gone, and she doesn't even know she had a heart attack and heart failure, and why am I getting these meds, and yeah, and can't remember me some days, and it makes me really cry. But I started a conversation with her. What, suppose you are getting dementia or Alzheimer's. How would you want me to handle that? And well, I'm not, my brain is fine. I'm sharp as a tack. Yeah. And, but then she goes through everything she's done to set up. I've in the cremation society, sprinkle me here, and so she feels she's prepared for whatever. And I am her power of medical. And so the resistance I meet with, you made me power of medical attorney and medical affairs, and I'm doing this under your wishes, and you asked me to do this, and this is why I'm taking you to this doctor. Well, I've got these nurses coming in and giving meds because you overdose. So it's a lot of repetition. We haven't had any of there was one time, she lives in a independent living, facility, which has full life care and a memory floor. But right now she's still able to manage that. But, the things, and Jessica, I appreciate your saying take notes, because I do a date when she says these things that make it profound, that, it's the vascular dementia piece. I'm afraid, we went to lunch in the building, and I was, taking her back up to her apartment, and she says, where am I? I'm afraid to be here, where is this? And so it's just a lot of repetition is what I've found. And I do a lot of humor and jokes and serious. So I go back and forth because that was our former relationship. But I could see her acceptance created this angry at me, pushback at me. I lost my favorite aunt. And so rebuilding the relationship with her current cognitive state that's just the new course. And I found that support groups and people with various different experiences and ideas, and I go back after my monthly meeting. I want to do it every day. That's why I'm in this conference, because every day there's something different, and somebody else who's been through this will give you an idea. So I just say, hang in there, and lots of love, and it's an honor to care for them, even when they don't want you to. And so thanks, Donna. And I never thought that I could reach out, nationally to other support groups. So I appreciate that, because I couldn't, crazy, I'm in Chicago, and I'm like, where is help? So anyway, thanks a lot, everyone.
Was that Yvonne?
Yeah.
Thank you, Yvonne.
Sure.
I live in Chicago.
Who's that?
Constance.
Hi, Constance. How are you? I was working with the Senior Center at University of Chicago when she got that diagnosis. And
Oh,
do you know Christine Bernhardy?
no, I don't.
She's do you know who? Somebody knows her? No, she's been a good resource for me. And I actually found a caregiver training coaching thing, and I'm just I don't know where my mind was, that I didn't think I would have this with 90-year-olds, and my mother was 102 and 103 when she passed.
I'm going to pause you just so we can get to my question before we close.
Oh, I'm sorry, I'm a talker. All right.
Oh, I'm sorry. I'll put my number in the chat.
Oh,
Thank you.
please. Thank you.
Anne, you have your hand raised. Go ahead.
Yeah, I wanted to respond to what Ed said as well. And I'm a gerontologist. I work at a geriatric psychiatry clinic. And what you're describing is not uncommon. However, nowadays, there are a lot of resources for people who are the caregivers. And those are the types of things that your brother-in-law and probably you should look for. And the other thing that I recommend is whatever you do, don't engage in any kind of a adversarial discussion, because that's going to get you absolutely nowhere. And validate. Someone put in the chat, meet them where they are. That's couldn't be more true. And also, you can sometimes completely redirect their thinking when you do that. And then you're out of the woods. So you don't have to deal with the problem you thought you were going to have to deal with in the first place. The other question I have is, would you do anything differently in terms of her care if she were clinically diagnosed? Because in a lot of cases, that's not going to make any difference in the way that you care for this person. So
the-
ask yourself that as well. That's,
Yeah, one of the things, not having a diagnosis, is there something wrong with her that could be treated? I mean, I see the symptoms, they're very obvious, but I'm calling it Alzheimer's, but it could be something else. It could be a brain tumor. It could be UTI, a number of other things, but without the diagnosis, I can't, there's nothing I can do.
And I would encourage you again, Ed, I think we have to wrap up here, but I would encourage you to check out the app where we actually ask these questions and give you some sense of whether it's a reversible condition that might be explaining the symptoms versus one that's irreversible. It's just an educational tool. It's not diagnostic, but it is helpful. And I think that's a very legitimate reason to pursue a diagnosis. Usually when you're several years in, it's very unlikely to be a reversible cause, particularly with an older individual. Even if it is something like a brain tumor, if you're several years into that, you know, that it's, and the person is much older, you're going to also be constrained in like what you can really do about those kinds of things. But it is important to know if there is some treatment definitively that would help them to recover that function. Of course, we want that. So I do think that's a really great point. Anyway, thank you all so much for joining us. For those who didn't have an opportunity to chat, please do join us on Sunday from 2 to 3 p.m. We're going to have one of these, which we have every week, where really you'll have much more of an opportunity to talk. We don't actually talk for a lot of those. It's an open forum. Thank you very much, everyone.
Thank you.
Constance?
Yes.
Oh, it's Yvonne.
Oh, hi,
Hey, so I'm on the south side in Woodlawn,
Yvonne. Mm-hmm.
and I'm at I put my number in, but I mistyped. So it's 240-355-4272.
Wait, hold up for a minute. Okay, what is it?
240-355-4272. 240. It's a Maryland number.
Oh, 355-4272.
240.
Mm-hmm. Okay.
Oh, please call me.
What happened?
I'm just
It says 240.
yes.
Talking to me. Okay. All right. I'll call you in a little bit after I check in with them.
All right, thank you. Bye-bye.
You're welcome. Bye-bye.